Hello everyone. I'm Nilesh Maheshwari from Amorphous Health. Welcome back to the Healthcare Musings with Nilesh.
I'm a physician by background. I've worked in several different settings, including integrated delivery systems, health systems, hospitals.
So today's focus is on value-based care, a model that prioritizes patients' outcome over the quantity of services provided. This shift towards better health management has the potential to improve patients' well-being and reduce overall healthcare cost. But transitioning to this model does not come without its own challenges and problems. But that's where the technology comes in. Hello everyone. I'm Nilesh Maheshwari from Amorphous Health. Welcome back to the Healthcare Musings with Nilesh. Today's focus is on value-based care, a model that prioritizes patients' outcome over the quantity of services provided. This shift towards better health management has the potential to improve patients' well-being and reduce overall healthcare cost. But transitioning to this model does not come without its own challenges and problems. And that's where the technology comes in. And our guest today is leader in this field. So welcome Sanjay Doddamani, founder and CEO of Guide Health, and he's here to discuss how healthcare providers can thrive in the value-based care environment. So once again, welcome Sanjay, and could you please introduce yourself?
Yes, and thank you so much, Nilesh. It's very kind of you to have me on your podcast. I'm a physician by background. I've worked in several different settings, including integrated delivery systems, health systems, hospitals, as well as in the federal government, and have most recently been as an entrepreneur in two, startup environments. So really glad to be on.
Excellent. When we are talking about value-based care, and you have been the expert on that, can you tell more about what is value-based care and why it is tough to implement, or what are the biggest challenges in healthcare ecosystem, and what providers face in transitioning to the value-based care?
Certainly. For me, it's really important about being an evangelist for good healthcare. And whether that's done in a fee for service environment where you're conscious of the clinical outcomes, or whether you are trying to shift away from a transactional based payment model to one that is measured on the outcomes and the savings. In other words, the reduction in total healthcare costs that could be associated with better access, better interventions, better clinical outcomes, and that there's a form of measuring that shift and improvement, and that physicians or providers are rewarded and patients have better outcomes that are measurable. That's really, in a nutshell, what value based care or the shift to value is about.
Okay. And how does technology solutions specifically address these challenges and improve patient outcomes?
So, as you can imagine, in delivering good healthcare or value based healthcare, there's a lot of complexity. One, you need really solid data integration and management. And there are a number of challenges because you have disparate data sources. You have a need to pull in claims and clinical records on a unified system, and that's always complex to have concurrent data and actionable data. The other is, integrating and analyzing this and producing something that you can actually use. It's also a shift in mindset because people have, historically just been very transactionally oriented, and that, could rack up costs. It could really create an environment where we're not, aware of the inequalities or the worsting challenges and the needs that are and the constraints that are put on staff and others that really leads to burnout. So communicating these benefits, engaging stakeholders cannot be underscored. The other is following the money. I mean, financially, and understanding that even to shift to value, there's an investment. And then once you can get beyond that and have the infrastructure and the care delivery model, that requires often a phased implementation, you could start to mitigate these financial burdens. And so to me, financial incentives need to be understood, but really in order to deliver on against them, you need to be incredibly conscious of the costs associated with delivering or shifting to these models. And then finally, there's a number of regulatory and compliance challenges that you just need to be aware of. I do not think that those should prevent you from shifting to value. And the most important barometer of that is patient engagement. If your patients are happy, they're understanding, how better care can be delivered, that's conscious of access and, good understanding and data driven and based on, outcomes, I think they will appreciate what, is how your care is being delivered and how that shift is occurring.
Okay. When we talk about technology, can you give any example where technology has helped providers to achieve better value-based care, results like cost reduction or improved quality matrices? Is how it is measured?
Yeah, so obviously we're living in a new era, which is very exciting. But if you think about the foundation of having data analytics that we talked about, that's important. And now with these advanced AI solutions, machine learning and predictive modeling, you can really get to knowing, who are your high risk patients, and you can even predict adverse events and be more proactive in engagement. The other is the advent of an omni-channel front door and an omni-channel approach. That includes telemedicine. It includes remote patient monitoring and collecting data and using that data to increase access and reduce hospitalizations and provide, better management, especially for chronic conditions. And then finally, we're living in an app world. So if you can engage patients to, use your portal or to have your portal help them with providing easier access to their information, more personalized healthcare, you could really, I think, move the needle on patient satisfaction and improve medication adherence, which is so important. And then, I talked about being an evangelist. To me, improving health literacy and reducing the burnout associated with healthcare are really vital to a better healthcare future. You talk about very specific examples in technology. I mean, one is predictive analytics that is AI based and reducing 30-day readmissions could save on penalties, improving quality metrics, improving stars and HEDIS measures are an important way. And, uh, specific measures in diabetes and hypertension getting to goal, I think are very important to reduce downstream events like heart attacks, strokes, and even kidney and other complications of diabetes. They're important. And then finally, adopting a telemedicine platform means that you can now expand your geographical outreach, especially to underserved areas. There are many deserts in the US that don't have access to specialists or other high quality providers. And all of this requires the data security. It requires a technology solution provider. It requires robust security practices, and that's where people get tripped up.
Right. When we talk about value-based care, to me it seems that it is a complete like a 360-degree approach where providers are delivering care as well as patients are engaged and they are also um giving a feedback. So there is a complete feedback loop which actually completes the whole value-based care. Is that a correct understanding?
Well, I could appreciate what you're trying to say. I think to me, the feedback loop is that you have a good lens on the health outcomes. In other words, you're tracking your costs, you're tracking your clinical outcomes, you're tracking quality, you're tracking patient experience, you're tracking provider experience, your net promoter score, and
Hmm.
the overall total costs of healthcare delivered. It's a real travesty when patients present late for a condition that could have otherwise been treated sooner with far fewer complications and far fewer risks to them and far less burden on having to deal with late stage presentations for conditions that could have otherwise been managed sooner. To me, using data science, using access to more concurrent data, and most of all patient feedback, and helping them to gain access for things that they could have otherwise have addressed sooner is really important.
Hmm. So, is there any special consideration to be done in regarding to data security, privacy in the whole context of value-based care? Any special consideration, or it is like same as we are in the healthcare ecosystem?
Yeah, so I don't want to sound like a Debbie Downer here, but it is important to be compliant. You need to know what regulations exist, whether it's protected health information and HIPAA security, whether there's infrastructure in place to be able to detect breaches and have administrative and physical and technical safeguards for security, especially for electronic protected health information. There was a high tech act that obviously is important for recognizing this enhanced HIPAA and penalties associated with breaches. We're living in an environment, especially I think there's been a lot of recognition more broadly after the Change Healthcare tobacco incident, and so being aware of that. And then there's some state laws associated with some very specific data production. There's encryption needs sometimes for data, especially on an interoperability basis. And then things like access, role-based access, multi-factor authentication, and other regular security audits and things like that. Those are not necessarily, we all need to be aware of them as healthcare providers, but I think maybe that question could be better addressed by somebody who's very specifically in the data security field.
Okay, sure. So the whole concept of value-based care was introduced, keeping the patient interest at the center. So do you think that with whatever work has been done in past few years in this regard, are we moving in the right directions, or providers are chasing it only for the financial incentive? What are your thoughts on that?
Physicians and allied clinical staff, I think, join their health profession because they truly want to make a difference. They love taking care of patients, and there's a reward in helping to alleviate, pain and suffering and improve, results and deliver better care. Everybody, I think, at some high level wants them. It's the most important thing is to align the incentives that avoid, either behaviors that drive financial motivations. And to me, we need to keep it simple. We need to all focus on improved access to care. Think of telemedicine as a great way to eliminate those geographical barriers and get specialists more involved sooner.
Yeah.
You can always get the physical exam done and have the patient interact with the specialist at a later stage. The most important thing is to get them plugged in. The second is to enhance the coordination of care. There's so many, sort of pitfalls in and things that drop, whether it's picking up your medications or whether it's updating your list or even just addressing your symptoms. And it's really important to understand that, especially patients living with chronic conditions, have a lot of different needs that need to be supported and entering into a care plan. The third is that we do have finite, health spending, that you can't just, rehospitalize patients for the same condition endlessly. And the overheads to deliver healthcare just continue to keep rising. And most of these costs are transferred either onto employers or onto the government, or even sometimes onto the patient. And so that's where I think it really, makes my blood boil. And so we've got to find a way to avoid wasteful spending. And then finally, improving patient satisfaction. If you can help improve the convenience of care, help move care along, especially between visits for chronic conditions, and then use the emergency services where needed, then we're not going to have overcrowded emergency rooms and, hospitals where people are waiting for beds. And so at the same time, we need to fill the beds with the right hospitalizations. And that to me is essentially what the rubric of value-based care is. And that's what we as a company espouse in terms of that total lens or the total journey of the patient throughout the ecosystem. So, in summary, physicians, I think, want to do the right thing. We need to ensure that the incentives are aligned, and we need to make data interoperability and communication, and to create an ecosystem for everyone to participate into. Everyone has to win. You can't be a, I guess it is a zero sum game if you don't allow folks to collaborate more effectively and increase the pie.
Definitely, that is well said. I think it has to be win-win for all the ecosystem players. Otherwise, it is not going to survive or sustain long term. So, when we have shifted to value-based care, so how does it impacts or affects positively or negatively the doctor-patient relationship and quality of personalized care?
So, doctors and physicians and providers, because of the understaffing, because of the shortage, they're all under time pressure. And the other thing is, it's not just about the patients who are in your exam room. There are patients outside your four walls who you're still accountable for, who you still, have had some interaction with in the past. And so, how could we improve the, overall touches and get the right patients in at the right time and still continue to make sure that care is being transacted? That's where telemedicine, that's where remote patient monitoring, especially in value-based settings where we can collect and integrate data, create these alerts, whether it's proactive alerts, whether it's preventive care supports, whether it's early detection, patient engagement, a focus on reducing avoidable hospitalizations, and then using those data to engage patients. I think that's where we could have real wins, like for diabetes or lifestyle coaching stuff, or in heart failure to help reduce symptoms like shortness of breath and fluid swelling, and get some early warning signs and symptoms in place so that patients aren't landing up with sudden emergencies. And then the other area is, especially after the pandemic, I think we all recognize mental health and behavioral health are so important. And so having access to remote therapy or medication management for all kinds of mental health and behavioral health conditions are important.
Yeah, I think you said the same point which I was about to say related to the post COVID. It is all about remote patient monitoring, telemedicine, mental health. They have been a very important aspect of care management, and more and more patients are needing that kind of like care at home and throughout the journey. So, and we have worked on similar type of solutions, and we see that there are a lot of positive outcomes when patients are engaged continuously through remote patient monitoring or chronic care management solutions. So let's move to another a question related to policies and policymakers. So how can policymakers and healthcare organizations collaborate to foster the development and implementation of a successful value-based care models?
Look, what's already in place from a regulatory standpoint can still be, I think, uh, you can engage on those issues and engage with policymakers so that things are concurrent. But the other part and the opportunity is where we can use test environments, the demonstration projects, or a model that is part of the, let's say, Centers for Medicare and Medicaid Innovation. Those are great places to engage on what the future of healthcare needs to look like. And so that debate and the dialogue should continue, and people who are stakeholders should continue to engage. But if folks are thinking about very selfishly how they can forward their agendas, then I think it's going to become pretty clear. And we're still never going to like find common ground and try to solve some of these greatest challenges of our time.
Okay, okay. So let me switch the topic to your solution. So, can you share some insights into your company's future plan goals and what actually your value proposition towards the value based care?
Yeah. So I guess as we wrap up here, a little plug in for the work that we are engaged in is we recognize that it's not just about one individual patient or one individual line of business, that, the place and the breaking points for especially value-based care are often because a failure to recognize that there's a broader ecosystem at play. So we've partnered with health systems who manage clinically integrated networks of both primary care physicians and specialists. We believe that everybody has to have a common view on the data side, that they have to have levers to help, move the care along. We have a wonderful team of health guides who are really patient navigators with enhanced training, and they support high risk members and patients to ensure that their care is being coordinated. We also have an MSO or services arm so that scheduling, prior auths, insurance verification, and things like care gap closures, quality gaps, identification of these things like mammograms or colorectal cancer screening and other age appropriate cancer screening, management of diabetes tests and things like that are all being focused on from a preventive side. So that's what we do. And we make sure that we work into the existing workflows. We use an extensive data mapping to do all of this work. And then, aligning the incentives and being part of the financial, broader ecosystem ensures that physicians maximize the opportunities that they have to improve care, clinical outcomes, and reduce spending, and that they actually have a financial incentive that aligns in a value-based care rubric. Health systems also are, as conveners, have expenses and they need to come out ahead. And then we as a company have a path to profitability. In terms of, as we sort of wrap up, what advice I would have, because I know you would ask me that ahead of this meeting, I would say follow problems very intensively. If you're looking to turn a quick buck, that's not really, healthcare is not the right place to do that. I think that we really need to understand what the problems are and really hone in with a laser sharp focus onto what these problems are. Map back to all the regulatory landscape so that you understand it. Don't let that prevent you from being creative, and then build a minimal viable product that tests your concept and have frequent feedback loops. I always say fail fast, but fail forward so that there's learning and share widely in your experiences. And then finally, we need to focus on patient outcomes. If it's not helping the patient, if you're just focused on a procedure or you're focused on some kind of innovation tool, but it doesn't actually drive better care, better outcomes, then you need to rethink your plan. Otherwise, you're going to be found to not be really part of a solution. You're going to find that you're really, sort of not in the center of solving healthcare. So there are a number of great areas. Think of the digital transformation opportunities with AI, whether it's in diagnostics or whether it's in health services or whether it's in patient engagement strategies. All of those are part of the approach to chronic diseases. And then, of course, we're going to see other areas where we're revolutionizing patient care delivery, creating much greater stickiness between payers and providers, and getting everyone onto the right footing so that we can actually deliver better care and better health outcomes. So I'm optimistic, but I think that as a startup entrepreneur myself, there's a lot of learnings, and the most important thing is to pick a great problem that you're trying to solve that's very timely, and have a team that's coming together to focus on that.
Excellent. That is a great insight for the budding entrepreneurs and people who are looking to work on the healthcare problem solving. And this was very insightful, Sanjay, and thank you for being here on my podcast. Your experience and expertise and your insights about value-based care and your product, around your product, that is really going to be helpful to all the people who are going to listen to the podcast. And thank you very much.